Today, guys, we're going to be covering that it's not too late to change your plan. We're going into the 1st of January and all the way until March the 31st. We're in what's called now the Open Enrollment Period. If you've enrolled into a Medicare Advantage plan during the AEP season or last year and that plan is not suitable for your coverage needs right now, you do have time. We're going to be discussing in just a minute exactly who can change, how to change, and how to make life easy by making Medicare simple for you. We'll talk to you in just a moment. Hey guys, it's Kelby Hightower with Medicare Hub, and it's great news. It's not too late to change your plan. If you have made a plan during the AEP season, that's from October the 1st or October the 15th to December 7th, and that plan is just going into effect January the 1st. From January 1st all the way through the March the 31st, it's called Open Enrollment Period. And I'm going to go over the basics of the Open Enrollment Period. And if you've been affected by maybe getting churned to a plan that your doctor doesn't take or a specialist doesn't take, or all of a sudden you're showing up with your new card at the pharmacy and you realize your medication costs that were supposed to be lower is much more higher, and you're looking at going back to the Medicare Advantage plan that you're on, or altogether you need to change to a better plan because of your specific need, Medicare provides this open enrollment period to allow you to be able to make changes. We're going to be discussing that here in just a second and going over the details of exactly what you can do. So here's the big rules around open enrollment period. If you are on a Medicare Advantage plan, you actually can go back to original Medicare and choose a standalone prescription drug plan. Now, for you guys that have been on a Medicare supplement and you went from a Medicare supplement to a Medicare Advantage plan and you decided, it's kind of like buyer's regret, and you're like, I don't want the Medicare Advantage plan, and you've never been on a Medicare Advantage plan before, you're in your first year trial right period, which allows you to be able to change back to that Medicare supplement plan without any underwriting and choose a prescription drug plan. But also during the open enrollment period, if you're on a Medicare Advantage plan and you just don't want to be, and you want to go back to original Medicare only and pick up a prescription drug plan, and you're past the age of 65, or what they call the initial enrollment period, when you can enroll into any plan option without any underwriting, you can go back to original Medicare, do a drug plan. And then if you want to choose a Medicare supplement and your health will allow you to underwrite, someone like us or our agency can help underwrite you for a Medicare supplement and get you onto a supplement and take you off that Medicare Advantage plan. So from January to March the 31st, you have that option. The other option is if you're on a Medicare Advantage plan, if you're on an MA with no drugs or an MAPD that has medications on it, you can change from an MA to an MA plan, or an MAPD to an MAPD plan, or an MA to an MAPD, or an MAPD to an MA. Basically, you can change from one Medicare Advantage plan to another Medicare Advantage plan, or a Medicare Advantage plan to another Medicare Advantage plan during this January through March 31st, which is called Open Enrollment Period. And then the big thing is just remembering that if you have questions and you're really unsure, like, hey, I enrolled, I think, can I change? Do I change? You know, this plan is not going to cover your doctors or your specialists or medication or hospital like you thought it was. Maybe you enrolled by calling into an 800 number off of a TV commercial, and all of a sudden you realize that, you know, this person didn't communicate clearly to me and I made a bad buying decision or enrolled into the wrong plan. What do I do? You need to be able to call a licensed agency like us that takes the time to look at your primary care doctor, your specialist, your medications, and to put it into a platform and really do a proper review and guide you towards the right Medicare Advantage plan. Or it just may be that you need to enroll back into the Medicare Advantage plan that you're on. Either way, guys, we invite you to reach out, call us if you have any questions, or if not, please like and subscribe to our channel. We'd love to be able to have you follow along with us as we provide content each week to you, educating you, making your life easy by making Medicare simple. Until next time, we'll talk to you soon.